Now, there are some special circumstances that sometimes come up that really bring out questions about breastfeeding. And probably the most common of these is previous breast surgery, particularly breast augmentation, but also breast reduction or breast biopsy that was done for a suspicious mass in the past, for instance. And the truth is that any breast surgery, there's a pretty good chance that you'll be able to breastfeed, but sometimes you won't. Now, in the situation with breast implants, with breast augmentation, most of those women are able to breastfeed. And in one study, only 7% of women were unable to breastfeed after breast augmentation surgery. So that's pretty good, actually. 93% success rate in women that were motivated to breastfeed that had had previous breast augmentation surgery. They also did a study particularly looking at silicone implants because there was some concern that the silicone could leak through and become a problem with the baby. And that turned out not to be the case at all. Actually, breastfeeding with silicone implants is completely safe for your baby, so you don't have to worry about that. So if you're able to do it, it's completely safe. Now, some of it will depend on the type of augmentation surgery you had. Surgery that's done with an incision around the nipple tends to have the highest chance of being unable to breastfeed, whereas the type of implants that are placed through an approach in the underarm or underneath the breast tend to be less disruptive of the breast tissue, and particularly the breast ducts, and so breastfeeding tends to be more successful. But the truth is, most women who've had breast augmentation are able to breastfeed just fine, and it doesn't cause any problem for either mom or the baby. More women that have had breast reduction surgery are unable to breastfeed than women that have had breast augmentation. And that's because it's much more disruptive to the breast tissue and particularly to the ductal system. But still, many women that have had breast reduction surgery are still able to breastfeed afterwards. And so it's definitely worth trying, and more likely than not, you should be able to breastfeed after reduction surgery. Now, having a breast biopsy in the past because of, for instance, a suspicious mass, that's no reason that you can't breastfeed, and it'd be very unlikely that would cause a problem to keep milk from coming, particularly since this is usually just one-sided. And so if anything, you really only need one breast to breastfeed. In fact, you can make plenty of milk from just one side. And so if there's a problem with one side but not the other, it's okay to just use the good side. That breast is capable of making as much milk as necessary. And so that's another strategy that can be used if you've had, for instance, extensive surgery on one side but not on the other. So you can breastfeed on the better side, and that will be fine for the baby. The other thing that sometimes comes up are women with breast piercings. It's safe to breastfeed after having your nipples pierced, but obviously it's important to take the piercings out before you breastfeed. You wouldn't want the piercing to fall out while the baby's breastfeeding, as that could cause problems if the baby were to choke on the piercing. So you certainly want to take your piercing out before you breastfeed. But generally speaking, nipple piercings generally don't disrupt the duct system, and it's usually very easy to breastfeed after having your nipples pierced. So you don't have to worry, gee, I've had a piercing, now I won't be able to breastfeed. Generally not the case. So those are some special circumstances that come up that women often ask me, gee, I've had this done in the past, will I be able to breastfeed?